Karen Perry. I was the lead reviewer and author of a report about a young woman who the partnership is called Child 17. Today I'm going to do a learning briefing for you, which will cover an introduction to the case, the conclusion, the key learning points and the recommendation. The presentation is designed so that you can use it by yourself, but it's particularly suitable to be used with a small group because you will find there are some stop and think, reflection and or discussion points. If you want to read the full report, there are details at the end about how you might obtain it. You will find that that is helpful to understand the whys of the decisions that people made in terms of their practice at a level of detail that I'm not going to go into. Okay, so let's get started then. This case involved a young woman who called Child 17, who was age 15 at the time that she was raped by a man known to her mother. She lived with her mother at the time, and she still does. And the time frame from the review was when she presented at hospital emergency department with symptoms that could suggest sexual abuse or exploitation. That was May 2020 until August 2021, when she was raped by an associate of her mother. Background to this case, Child 17 had an education and healthcare plan. She has attention deficit hyperactivity disorder, dyspraxia, and sensory processing difficulties. So quite a range of difficulties that impaired her functioning, both educationally and socially. Within the review period, key practice incidents were the attendance at accident and emergency, the emergency department, which I've already mentioned. In July 2020, mother reporting to CAMS that Child 17 had been groomed over the internet by an adult male. And in August 2020, when she was re-referred to the occupational therapy service for help with her motor planning and coordination skills. Between August 2020 and March 2021, the Intensive Family Support Service was involved after a referral from CAMS. And CAMS made this referral as a result of mother expressing concerns about the internet and the relationship with the adult male. It wasn't a relationship, but the approach by the adult male. And also there were some difficulties in relationship between Child 17 and mum. And in addition, Child 17 wasn't in school. The level of her anxiety meant that she hadn't been in school for a few months by then. In April 2021, Child 17 started at a new secondary school. In July 2021, she went missing for a few hours after disclosing suicidal ideation to the CAMS worker. And then, of course, in August, she was raped by mother's friend. So, in terms of, that was the case summary for the child's story. If I give you a bit of background about the perpetrator, and he has been now convicted of rape, of multiple rape of Child 17. So from 2006, he had contact with the mental health services. And from 2007, he was subject to multi-agency public protection arrangements due to being convicted of a rape of an adult male. And within the review period, in August 2019, he moved to Trafford. But in fact, there was limited oversight by the Police Sex Offender Management Unit. That's the acronym SOMU, and we'll talk in detail about that in a bit. In March 2021, he started the friendship with mother, and this wasn't known to agencies. In April 2021, he was charged with the rape of an adult female. Okay, so before we focus on the learning, I just wanted to take you through the conclusions to give you a bit more context. So it was capacity, time. and technological issues affected the oversight in the Section Offender Management Unit. The responsible officer didn't complete the routine assessment contacts with Mr. X in the period under review. And also, Mr. X had made very serious threats against a neighbour, which should have prompted a revised risk assessment, but this was not done. We'll talk about why later. Because no agency knew about the friendship with Mother, better oversight by the SOMU might not have prevented the rape. Might have done if they'd known about it, but it might not have done. However, child 17 was potentially vulnerable to sexual abuse or exploitation by others. More could have been done to protect her from that by raising her and mother's awareness about this. And there's some learning regarding this for the future benefit of other similarly vulnerable children. So, briefly, methodology for CSPRs, because I'm sure most, if not all of you, have not previously been involved in one. It's really, really important that we engage frontline staff and first-line managers, but frontline staff in particular, because their insight into how things were for them in terms of their practice environment and why they made the decisions they made is critical to understanding what the learning might be and how, if any changes are necessary, what might best help vulnerable children like child 17. I try to leave them in a collaborative and an analytical process. And as I've already said, I focus on why people acted in a certain way, practitioners acted in a certain way. This is a no blame culture because what we're trying to do is identify learning. And we want to use this case as a window on the system. And what that means is that we draw a distinction between things that happened in service delivery terms that were unique to this case and things that happened in service delivery sense that are systemic, that will happen again to other children in similar circumstances. And those are the ones to focus on if there's learning about improvements. We need to remember always that the review is about child 17. And it's really important to identify and promote what worked well and good practice, of which there was a number of things identified in this report, which is identified in this review, which you will find details of in the report, because we can learn from those. And it's also important to have family involvement, preferably as early as possible. Although in this case, the young mum felt the young woman wasn't resilient enough to speak to me, and she didn't feel resilient enough to speak to me either until I'd finished the review, although nonetheless she was able to give me some views which were included in the report. So let's talk about the learning points, going through them theme by theme. And the first theme was assessing, monitoring, managing risks posed by the perpetrator. And most of this learning was for the police, although there was some for the partnership as a whole. So the first learning point was about effective risk management being undermined by poor electronic recording systems. The police had installed a new electronic recording system called IOPS. Unfortunately, the implementation meant that there were duplicate records for individuals. So the offender manager didn't see all the information about Mr. X because some of it was on a duplicate record. The most pertinent example being the rape of the alleged rape of the adult female. And also some of the flags disappeared, the risk flags disappeared from some of those records. The second learning point was about effective supervision and senior management oversight requiring regular monitoring reports, which clearly identify overdue tasks for high and very high risk offenders. This again was an issue due to the electronic recording system. And because those monitoring reports weren't available, the supervising officer wasn't able to identify priorities, and neither was the offender manager, and nor was the supervising officer easily able to identify gaps in practice. in this case, that the assessment visits had not been completed. And the last one is learning for the partnership. There wasn't a good system to support the use of the partnership risk management register to help mitigate risk. Every safeguarding partnership should hold a strategic risk management register to identify and manage very high-level risks to children and young people. And clearly, a police recording system that wasn't effective did pose risk to children and young people. And the police did inform the partnership, but they didn't give sufficient detail for partners to be able to work out what contribution they could make to mitigation of the risk. And there was no system to review progress on addressing the issues to ensure that the risks were managed until they were no longer there. Again, more learning points to the police: assessing, monitoring, managing risk posed by the perpetrator. So, excuse me, the Mr. X was involved in a neighbour dispute where he made very serious threats, including threats to kill. But these were known to the offender manager. And the learning here is that even when they were known to the offender manager, but they weren't followed up by the offender manager. And the learning is that even when these are not obviously directly related to sexual offences, serious incidents in the community committed by sex offenders must be followed up by offender managers. And the context in which both the offender manager was working and their supervising sergeant is really relevant to the difficulties in managing the risk posed by Mr. X, because they both had very high caseloads. There is Home Office guidance about the level of caseloads that an offender manager should have, and the offender manager had twice the number of cases recommended by that guidance. There's no guidance for how many cases a supervising sergeant should be overseeing, but we had advice from experienced officers about what would be a suitable number, and that supervising sergeant had 5 times that number. So given the working environment, that contributed to how difficult it was for those staff to do their job effectively. The second theme was about vulnerability to sexual abuse. And for the avoidance of misunderstanding, absolutely only Mr. X was responsible for the rape of child 17. Excuse me. And agencies didn't know that he had a link with the family, and mum didn't know his history. However, at the same time, it was clear that child 17 had some vulnerability to sexual abuse or sexual exploitation. So in those circumstances, the first learning point applies that when mothers and children might be vulnerable, conversations about the possibility of someone in your current or future family circle being abusive should be considered. This is not an easy conversation. People don't want to believe that maybe somebody in their immediate circle or somebody who they might meet new might have adverse motives for getting to know them, but these conversations need to be had and to enable parents, and in particular, but also young people, to recognise signs when they might feel unsafe. Second learning point was about the importance of asking parents and children during assessments about the people who are very involved in their lives, family and friends, and this inquiry should be repeated at reviews. But it's not to suggest that had these questions been more systematically asked, that the existence of Mr. X and his relationship with the family would have been identified. The timing of the assessments and reviews meant that perhaps that would not have happened, and in any case, neither mother nor child 17 may have seen him as significant enough to actually mention him, although he did stay with the family for a couple of weeks when, I'm not sure why, but he did stay with the family for a couple of weeks. So although it might not have made a difference in this case, asking parents about who's involved in your family is a very relevant activity. More on vulnerability to sexual abuse. Really important to have a conversation with parents about identifying risk and actual safety planning if their child might be vulnerable to sexual abuse and exploitation, and the potential benefits of supporting parents and children, especially teenagers, to draw up safety plans together, because it prompts those very useful conversations and reflection, and encourages them to keep themselves safe, independent of the practitioner. And in regard of both those learning points, actual written safety plans are a very useful tool. And the last learning point on this slide is to do with the importance of practitioners having an understanding of Sarah's law. Now, this is only one power which enables the police to disclose information about someone who has a history of sex offending. There are, in fact, lots of grounds, and if you as a practitioner, or indeed a family member, was contacting the police, they wouldn't expect you to be able to identify the precisely relevant legal ground. Having said that, it's very useful to understand that there is such a thing as Sarah's law, which means the police can disclose information if they feel that children and families will be vulnerable. Really important to have direct discussions with children who are vulnerable to sexual exploitation. In this case, there was evidence of discussion with mother about child 17's vulnerability, but there was no evidence at all of any discussion with child 17, even after the incident of the concerns about her contact with the adult male on the internet. When she presented at the emergency department in circumstances which could have involved adult encouragement for sexual exploitation, both the emergency department staff and the gynecological staff had contact with her, but neither asked about, probed for more details about this, how she was presenting, and neither made a referral to the front door. The other reason to have direct discussions with children is they will not get any support if they don't engage with any specialist service they're referred to. So in this case, both CAMS and the Intensive Family Support Service, they each referred child 17 for support regarding vulnerability to child sexual abuse. They didn't have any direct conversation with her, though. And when she didn't take up the service, this therefore meant that nobody had talked to her about those issues. So now's a moment for reflection and discussion. As I've already emphasised, the only person responsible for the rapes was Mr. X. Practitioners didn't know that he had a connection with Mother. Mother didn't know about his history. But nonetheless, even that being the case, there's still evidence that she could have been vulnerable to potential sexual abuse or exploitations by others. So have a think about two key questions. What conversations with parents about the possibility of someone in your current or future family circle being sexually abusive? They're sensitive and they're challenging to approach. What would be your top tips for approaching these conversations? And secondly, have you heard about Sarah's law previously? How best could information about this be publicised amongst practitioners and the community? So take a pause now of a few minutes to reflect if you're on your own, or to discuss if you're part of a group, those two key questions. Okay, so some more learning points on another theme: how agencies work together, referrals, assessments, and care planning. The importance of practitioners sharing information with IFS workers. This is to avoid duplication and so that you can each be able to build on each other's work. And the importance of ensuring that all practitioners involved with families contribute to IFS support meetings. In this case, there was some important information that wasn't known by the IFS worker and other practitioners working with Child 17. One example would be she disclosed some self-harm, which included the use of a ligature, which could have had really serious consequences to one practitioner, which wasn't shared with anybody else. Okay, learning points to do with Child 17's education and health needs. Really important for arrangements for collating information for education and healthcare plan reviews include GPs, because the GP has the record cradle to the grave, and they will know of other health services involvement in a way that individual health agencies might not know of other health agencies' involvement. And it's also really important to contact first response, because they will know of any early help or IFS or social work involvement. And this is especially important if the child's not in school. Usually, when an EHCP review is done in school, then the school staff will have a shrewd idea about who's involved with the family. And of course, Child 17, for a large part of the period under review, wasn't in school. The other learning point was about reflecting on the timing of ceasing IFS involvement, that it should take into account any forthcoming changes in family circumstances that might need support. And that, in this case, should have included admission to a new school after a prolonged absence. The IFS worker was really tenacious in enabling Child 17 to get a new school place. But then once they were confident that they have the new school place, they ceased involvement before the attendance started. And there was a really good transition plan developed by the school, and it was very effective in enabling Child 17 to make a very successful transition into that school. But the previous history might have suggested that this wouldn't have been as successful as it turned out to be. So it would have been beneficial just to pause a little while to see how it went before ceasing involvement. Okay, that's all the learning points. Let's move on to recommendations now. And recommendations should be mostly focused on multi-agency practice. They should address the most important learning points, and where there's been activity to address learning, which there usually is in most reviews, agencies crack on with addressing learning that they identified during the process. Where that has happened, it's really important to ensure the learning is embedded and the activity is embedded and it has an impact. So the first set of recommendations are all about the police, and they're all about seeking evidence from the police that they now have effective systems to address some of the things that weren't working well during the scope of the review. So the first one is about the Sex Offender Management Unit identifying sex offenders who may pose a risk to practitioners and or vulnerable people, including children, and sharing information accordingly. This man had a conviction for rape of an adult. He had allegedly raped an adult female, and those things should have been shared with practitioners so that they could think about how they worked with him. Effective systems to monitor the caseload of offender managers and their supervising sergeants and address any adverse workload pressures. Our understanding is that the staffing capacity has increased significantly since the period of the review, but nonetheless, that needs to be monitored. Also, to ensure offender managers follow up serious incidents in the community committed by sex offenders, even when they're not directly related to sex offending. That refers back to the issue to do with the neighbour dispute. And finally, to monitor and bring down the numbers of overdue risk assessments and visits to high and very high risk sex offenders in a timely way. And if you want information about how any of these recommendations are being addressed and what the progress is, it will be possible to find out how to do that, and the partnership office will be able to tell you. Okay, second recommendation is about the strategic risk arrangements that didn't work as effectively as perhaps they should have done regarding the risks associated with the new recording system introduced by the police, so that the strategic safeguarding partnership should consider how to improve them, and that such improvement should include agreement between the three statutory partners, and that's health, police and the local authority, as to what kinds of risks should be included, how and how often those risks should be monitored, and with regard to this particular case, seeking detailed information from the police about how any current technical issues for the IOPS system and evidence of the potential impact on vulnerable people and how they're managing this. And this should be regularly monitored, this particular risk, using the partnership's strategic risk management arrangements until successful replacement has been achieved, because the police have suggested that they intend to replace IOPS. The partnership should also consider how best to ensure that practitioners are confident about talking to parents and children about sexual abuse. This is a national issue. There was some research done that suggests that this is a difficulty that many practitioners experience. And learning from this particular case would suggest that such activity should include raising awareness amongst practitioners of the community of Sarah's law and the other powers that the police have to share information about risky people with members of the public, and the benefits of asking parents and children who is or has been involved with your family network, i.e. family and friends, during assessments and reviews. Both of those things might have been helpful in this case. This is about checking how effective arrangements are at the moment, that the strategic partnership should arrange a multi-agency audit to explore whether all the right practitioners are being asked to contribute to family support meetings led by IFS, and to check whether IFS involvement is being ceased at an appropriate point and step-down support considered and offered as necessary. Those are examples of changes that were identified that services wanted to make during the review, and this is about checking that those changes have been effective and had the positive impact intended. There was the next recommendations are that the strategic partnerships will also seek evidence from IFS that they have effective systems to monitor the caseloads of IFS practitioners and address any adverse workloads, because the IFS practitioner was also working in a difficult context, as was the service during the period of this review. And they should also seek evidence from the local authority that for education and healthcare plans and reviews, that there are effective systems to collect and collate information from all agencies who may be involved with a child, and that would include the GP, as I mentioned earlier. And finally, and last, few recommendations are that to seek evidence from the Manchester Foundation Trust that staff in accident and emergency and gynecological services recognise and follow up circumstances which might indicate children are being groomed or sexually exploited. Again, Foundation Trust has done some work in this area, but it's really important for them and the partnership to identify whether this has been effective. The next one is actually a national recommendation, which is relatively unusual, but to recommend to the Home Office that learning from this review would indicate the need for national guidelines on maximum caseloads for SOMU supervising sergeants. That relates back to the supervising sergeant having 5 times as many offenders to ensure oversight of as best practice would suggest is manageable. And finally, to seek assurance from each agency involved in this review that learning points have been identified and action has been or is being taken to address and disseminate them. Okay, so some more reflection opportunities. Spend a few moments now, either yourself or in your group, and identify 3 changes in your future practice because of the learning from this review. And the partnership is very eager to understand the impact of child safeguarding practice reviews on practice. After all, that's what we do them for, to learn and do better for the benefit of other children like Child 17. So if you're willing to share these examples, the partnership will be very keen to hear about it, and perhaps you could contact them at the email address below. And that email address, use of that email address will also enable you to read the full report or to know what action is being taken as a result of the recommendations. So thank you for listening today. I hope you found this presentation useful and that it's given you some food for thought about how you might be able to support teenagers like Child 17 even more effectively than you do already in future. Thank you.